This is Ann Cummer. I'm the Director of Speech Pathology at Cincinnati Children's, and today I'm going to be talking to you about communication disorders that are commonly found in the pediatric population. Before we can talk about different disorders, we need to discuss the different components of verbal communication. First of all, there's speech, or sometimes we use the term articulation or phonology. Speech refers to the physical production of individual sounds to form spoken words. In contrast, we have language. Language is the meaning or the message conveyed back and forth in talking. Whereas speech is the physical production of sound, language is a cognitive process. With language, we'll talk about receptive language, which is the ability to understand the words and the sentences that other people use. Expressive language, which is the ability to choose words, put the words together so that that's meaningful and you can convey a message. And then finally, pragmatics, which is the social use of conversation. The third component of verbal communication is voice, and there are two aspects of voice. The first is phonation. Phonation refers to the sound that's generated by the vocal folds. That sound is then altered or changed as it resonates in the different cavities of the vocal tract, and that includes the pharyngeal cavity, the oral cavity, and the nasal cavity. Finally, we'll talk about fluency. Fluency refers to the flow or the rhythm of speech. Now that we've discussed the various components of verbal communication, we can talk about disorders in these areas. A common communication disorder in children is a speech sound disorder. This occurs when the child has difficulty producing individual speech sounds. As a result, the child may do one of many things. The first thing that the child may do is omit the sound. So, for example, if the child is trying to say, "I ride the bus to school," the child may say, "I ride the bus to school," where most of the sounds were produced correctly, but some were omitted. The second thing that the child may do is substitute one sound for another. And typically what you find is that the child substitutes an easy speech sound, usually developed earlier, for a harder speech sound, which is later in the developmental sequence. So some common substitutions include these. T for K, I eat Tate and ice cream. D for G, I'm a good girl. P for F, I have pie fingers. T for S, I tea the ton in the tie. These are all very common, and one thing that you'll note is that the substitutions included some of those early developmental phonemes that occur oftentimes in babbling. The next thing that the child may do is distort the sound. With distortions, the child is attempting to articulate normally, but for some reason, the tongue isn't in the right place or the teeth aren't aligned appropriately, and this results in an acoustic distortion. One type of distortion is a lisp. A lisp occurs on what we'll commonly talk about as the teeth sounds. This is S, Z, SH, CH, and J. One type of lisp is a frontal lisp. A frontal lisp occurs when the tongue is too far forward and thus you don't have the sibilant or the fricative type of sound that you normally would expect with the sound being correctly produced. So instead of hearing, "I see the sun in the sky," you would hear, "I see the sun in the sky." Or instead of, "She went shopping," you might hear, "She went shopping." Another type of lisp is a lateral lisp. This occurs when the tongue is touching the top of the mouth or the teeth are in the way. As a result, the airstream that normally is emitted anteriorly is redirected laterally. So we hear a slurpy, slushy type of sound. So you might hear, "I see the sun in the sky, she went shopping." Distortions also occur frequently on R sounds. So instead of hearing teacher, you might hear teacher. Instead of hearing rabbit, you might hear rabbit. Now, another thing that we commonly find in the pediatric population is a disorder called apraxia. Apraxia occurs when the child has difficulty coordinating motor movements that are required for speech production. So the child with a very severe apraxia may even have an oral apraxia where when you ask the child to stick out his tongue, he has difficulty coordinating that movement. More commonly, the child is able to do one movement at a time, but has difficulty putting movements together for speech. So, for example, the child may be able to say ka and p, but when asked to say the word cup, the child may have difficulty and say something like paka or kt, and struggle to coordinate those movements. Another speech sound disorder is called dysarthria. Dysarthria is a motor disorder that results in slurring and oral inactivity. This is commonly seen in patients who have a history of cerebral palsy or even head trauma or traumatic brain injury. With this slurring, the speech sounds something like this. Now, in talking about speech disorders, I would like to refer back to some cartoon characters that I grew up with. I remember these characters on TV, and all of them seemed to have some difficulty with speech. So I made it my quest in life to find out what the problem is. This is Elmer Fudd. Elmer Fudd is the one that says, "Let me get you, you wascally wabbit." And what you'll note is that Elmer substitutes W's for L's and W's for R's. This is a very common articulation pattern in children who have difficulty learning to produce those different sounds. Now, I have to note that these kinds of substitutions are normal at the age of 2, but they're not normal at the age of 6. This is Tweety Bird. Tweety Bird's the one that says, I taw a putty tat." What Tweety Bird is doing is substituting easy speech sounds for harder sounds and using primarily T's and D's in the process. And this is Sylvester. Sylvester, as you recall, is the one that says "suffrin succotash," and you might even remember that he has saliva coming out the sides of his mouth. This is very typical of a lateral lisp. And Daffy Duck is also an example of a lateral lisp. There are various causes of speech sound disorders. Oral motor dysfunction, particularly apraxia, is a very common cause of speech disorders in the pediatric population. Various oral structural anomalies can also cause speech disorders. Dental malocclusion is one. If the malocclusion results in the tongue tip being forward or behind the alveolar ridge, this will affect articulation. A history of cleft palate, a fistula, or velopharyngeal dysfunction will affect articulation development. One thing of note is that ankyloglossia rarely affects speech, especially in English speakers. Hearing loss or poor auditory perception can be a cause of speech sound disorders, and sometimes the child just learns to articulate in an inappropriate way. In other words, we don't know what the cause of the problem. Now let's talk about language disorders. When a child has a receptive language disorder, in other words, the child doesn't understand what's being said to him, what we find is that the child may not respond appropriately. So when the child is asked to do something or ask a question, the child really can't respond appropriately to that request or that question. In addition to that, the child will have limited verbal output. And the reason for this is that the child needs to be able to understand the words and the sentence structures before the child will be able to actually use those himself. And finally, the child may have what we call echolalia. Echolalia occurs when the child echoes back what he hears in the environment. For example, if you said to the child, "Hi, how are you?" and the child says, "Hi, how are you?" Or you say to the child, "What's your name?" and the child says, "Your name." You say, Do you like chocolate? And the child says, You like chocolate? So basically what's happening here is that the child knows that he's being asked a question, or in some cases given a command. He just doesn't know how to respond. And so what he does is he echoes back part of what he heard. The good thing about echolalia is that children who demonstrate echolalia always let you know when they're getting better, because the echolalia is less and less. With expressive language disorders, the child may be totally nonverbal or may rely primarily on gestures to communicate. The child would have limited verbal output, where the child's not really using very many words or very many sentences to communicate. In some cases, the child's talking but uses unusually short sentences. And in other cases, the child is talking a lot, but the sentence construction is inappropriate, or it's very short or faulty. So I'd like to give you some examples of expressive language disorders. So these are language samples taken from 4-year-olds. And at the age of 4, the child should be communicating in long and fairly structurally complex sentences. The first child has short utterances and telegraphic speech. So the child says, that a ball, here a book, wagon, me got wagon, girl, that a girl, a soap, my bed, that a bed, give me that. So basically what's happening is the child is naming things and saying, look at this, look at this, look at this, or give me this, which is a very immature way of communicating. The next example is one that shows telegraphic speech and syntax errors. So the child says, him get out, him bed, him eat cereal, me like cereal, me no like eggs, him go school, the boy book, him re-book school, me got a book. The next example is of perseveration, where the child is naming some different things, but he can't come up with the right word. So he's naming a wagon and he says wagon. Now he's naming a chair and he names it as a wagon, that a wagon. Now he's presented with a boat and he says that's a wagon. So that's perseveration, where the child's saying the same thing over and over again and can't quite get off of that one response. This is an example of a semantic disorder. So the child says, that's a cat, naming a rabbit. That's a door, naming a window. That's a knife, naming scissors. Now, this next example is one where the child has difficulty with verbal formulation and many errors in syntax and semantics. So the examiner says, what do you do with a glass? And the child says, pour on the drink on the milk. What do you do with a fork? Eat fork with plate on the food. What do you do with a radio? You talk on the fire on your speech. What do you do with a pan? You put on the eggs on it ham. You scrub it. What do you do with a radio? You sing on it. That one's closer than the others. And what do you do with a clock? You get see what time is it? And then finally, we've got one where the child has major difficulties with pragmatics and syntax and semantics. So the child says, I wash my game in sink. Uh-oh, I got a sink. Hi, sink. What you doing, sink? I washed my sink 'cause Mommy said no. What you said? Look, a rocking sink. You know what she said? She said rocking the sink in the chair. Hi, chair. How you doing, chair? Where your chair in the sink is. So these are just a couple of examples of some different expressive language and receptive language disorders.